everyone, my name is Anna Maria Eating, this one C student. So today I'm gonna show you how to do the heat and cold application. So what is heat and cold? Heat and cold agents are applied in the area of a client's body to bring about a local or systematic change in body temperature for various therapeutic purposes. So the meaning of heat is the average kinetic energy or the energy of the motion of molecules of a material. Then the cold is a relative term, a material which has a relatively low temperature that is little or no warmth. So the purpose of this assessment is to, in the heat application, is to promote wound healing, to relieve discomfort, to relieve muscle tension and joint stiffness, to warm part of the body, and to reduce edema. So in the cold application, the purpose is to relieve discomfort, to limit inflammation and suppuration, to control bleeding through vasconstriction. In the effects of heat application is to vasodilation, decreases blood viscosity, thereby increasing rate of flow, increases tissue metabolism as increased blood supply, furnishes more oxygen and carries away waste. Next is the four muscle spasms. Muscles are relaxed if caused by congestion. It relieves as circulation improves, decreases blood pressure, softens exudates, hastens suppurative process, and increases peristalsis. In the effects of cold application, it is the vasoconstriction, slows down metabolism and decreases cell activity, lower temperature, decreases pus information and accumulation of fluid in body tissue, increases blood pressure, and anesthetizes the part applied. So the precaution of the heat application is that heat is contraindicated in the presence of an acute inflammatory process. Next is that heat is contraindicated in the presence of malignant tumors because of the dangers of increasing metastasis. Contraindicated for patients who are hemorrhaging since heat decreases blood clotting ability, and special care should be given for persons who are debilitated, unconscious, or insensitive or continuous stimulation. So in the cold application, cold is contraindicated when tissues are poorly nourished and when blood circulation is poor in an area of the body. Next, the cold is contraindicated when fluid in tissues has accumulated in an area, such as following a joint sprain, since cold acts to further retain fluid absorption by minimizing blood circulation in the area. Next is the cold is not used when muscle tension and spasms are present because cold will aggravate this condition. So this is not allowed. So the patient's general condition should be considered before applying cold. A special precaution may be made to be taken. The young and elderly are especially sensitive to cold application, as well as the weak and debilitated persons.
So here are the recommended temperature for hot and cold application. Next is the hot water bag application.
Application is the hot water application. The equipment of this assessment is the hot water bag, cover for bag, pitcher with water at the appropriate temperature of the 46.1 to 51.6 degrees Celsius for older children and adults. So the 40.5 to 43.3 degrees Celsius is for the infants, young children, elderly people, diabetics, and unconscious clients. Next is the back thermometer and the towel.
Determine the client's ability to tolerate the therapy. Identify conditions that might contraindicate the treatment. Assess the skin area to which the heat and cold will be applied. Assess the report of discomfort. Observe the local skin area for any untoward signs. Examine the area to which the heat or cold was applied.
This is the planning. Wash hands and assemble all materials and equipment to lessen time and effort and to prevent cross-contamination.
Check temperature of water with bath thermometer or test on inner breeze. Rinse bag with water empty and then fill. Fill hot water bag 1/2 to 2/3 full. Expel remaining air from bag in one of two ways. Place the bag on a flat surface, permit the water to come to the opening and then close the bag. Or hold the bag up, twist the unfilled portion to remove the air and then close the bag. Fasten top securely and check for leaks. Cover bag with towel or other protector and apply hot water bottle to prescribed area. Assess condition of skin and client's response to heat at frequent intervals. Do not exceed prescribed length of time for application of heat. Remove hot water bag if excessive swelling, redness, or pain occurs and report to physician. Dispose equipment appropriately and wash your hands.
Is the evaluation. Evaluates the client's response to the treatment to know if he or she is satisfied while doing the procedure. The last is the documentation. Record the size, location, and appearance of treatment area, status of pain, duration of treatment, and client tolerance to treatment to have a legal purpose and to gather some data or information.
Next is the hot compress.
In the hot compress or the basin with hot water, face towel, rubber sheet, bath towel at bedside, and forceps if optional.
Determine the client's ability to tolerate the therapy. Identify conditions that might contraindicate the treatment. Assess the skin area to which the heat and cold will be applied. Assess the report of discomfort. Observe the local skin area for any untoward signs. Examine the area to which the heat or cold will be applied.
This is the planning. Wash hands and assemble all materials and equipment to lessen time and effort and to prevent cross-contamination.
Next is the implementation. Explain the procedure to the client. Screen unit application of treatment makes unnecessary exposure of patient. Protect bed area with rubber sheet under the part of the body in which compress is to be applied. And after that is wash hands. Soak the compress into the basin with hot water. Apply hot compress to affected part. Watch skin carefully for sign of scalding. Repeat steps 13, 15, and 16 every 1 to 2 minutes for 20 minutes or as ordered by the physician. Dry area gently. And remove rubber sheet and leave the patient dry and comfortable. Do the aftercare of materials.
Next is evaluation. Evaluates the client's response to the treatment to feel the client satisfied and comfortable. The last is the documentation. Chart the following: the date and time of the treatment, reason and area of application, duration and reaction, if any, effects and signature of the nurse, to have a documentation and legal purpose.
Next is the hot seats bath.
So what is hot seats bath? Hot seats bath is a bath in which only the pelvic area is immersed in warm water. So the purpose of this assessment is to promote perineal and rectal healing through vasodilation, to provide comfort to the client and to reduce congestion after an examination. So the equipment are the patient's gown, bath thermometer, ice cup with cover, seats bath tub, bath blanket, bath towel, pitcher with hot water, safety pin, and hot water bag. Next is the assessment. Check doctor's order for a specific type of treatment. Assess client's knowledge of the benefits of the seats bath. Baseline vital signs, appearance and condition of treatment area, client's knowledge of benefits of seats bath, client's inability to remain unattended in bathtub, and status of pain. This is the planning. Wash hands and assemble all materials and equipment to lessen time and effort and to prevent cross-contamination.
Next is the implementation. Identify the client and explain the procedure to the client. Wash hands, organize equipment, and don gloves. Check temperature of water with thermometer. Place a rubber ring at bottom of tub and bath mat on floor. Assist client to the bathroom, close door, and assist client with undressing. Assess the client into tub using footstool if necessary. Set client on the rubbing ring. Ascertain client's stability in the tub alone and assess reaction to the heat. Observe facial expression and body motions for signs of discomfort. As if heat is too high, watch for dizziness, faintness, profuse or diaphoresis, and note any rapid increase or irregularity of pulse. Track the client on use of call light and place light within reach. Recheck client every 5 to 10 minutes. After 15 to 20 minutes, help client out of the tub. Assess client with drying and dressing, then place linens in hamper. Turn the client to room or bed.
Is remove equipment and clean and remove the gloves and wash hands to prevent cross-contamination. This is the planning. Wash hands and assemble all materials and equipment to lessen time and effort, and to prevent cross-contamination. The documentation, appearance of treatment area before and after treatment, and any unusual such as profuse diaphoresis, faintness, dizziness, palpitation, or pulse changes, and the duration of the cyst and the status of pain, to know the client is in a good condition after taking the assessment and to have a data purpose.
Next is the ice cup or the bag application.
Of your ice cup and bag application are the ice bag or cup, ball containing small pieces of ice and clean cover for ice bag. This is the procedure, which is the assessment, treatment's order, and client's response to previous treatment if used, to have the precaution during the taking of the cold therapy, and the condition and appearance of treatment area, which is the edema, local bleeding, and the status of pain, to know the condition of the client. This is the planning, wash hands and assemble all materials and equipment to lessen time and effort and to prevent cross-contamination.
Next is the implementation. Fill the bag with small pieces of ice to about 2/3 full. Remove air from the ice bag. Same manner as for removing air from a water bag. Secure the cup, test the ice bag for leaks, and place cloth cover on the ice bag. Apply an ice bag for only 1/2 to 1 hour and remove for about an hour before reapplying it. To discontinue, do the same aftercare with that in the hot water bag application.
Is the evaluation. Evaluates client's response to the treatment to know if the client is satisfied in doing the procedure, and the last is the documentation. Document the size, location, and appearance of treatment area, status of pain, duration of treatment, and client tolerance to treatment, to know that to avoid the bleeding, decrease of the client, and to have a data and legal purpose.